Okay, this is the first episode of our Noir series featuring Thayer Martin as Mac the Private Eye. It's about Neisseria meningitidis, and it's going to be called A Shocking Death on Campus. Okay, this scene is going to take place at a college dormitory. The reason for this is that Neisseria meningitidis is easily spread in close quarters like college dorms, and this is because it's spread by respiratory droplets. So be on the lookout for Neisseria if it's a college student or a college-age kid presenting with meningitis. So we covered the common features shared amongst the Neisseria genus in our Noir series poster. And Mac is here to investigate the scene, but also to remind you of these common features. And if you can't remember what they were, I'll do an 18-second recap. Okay, so Neisseria are gram-negative diplococci, oxidase positive, grown on chocolate agar, also grown on VPN, aka Thayer Martin agar, increased susceptibility in C5-C9 complement deficiency due to inability to form MAC complex. They have an IgA protease and fimbriae that demonstrate antigenic variation. And done. Now let's discuss something that's not a common feature between Neisseria meningitidis and gonorrhea. You should remember that only meningitidis ferments maltose. They both ferment glucose, but only meningitidis does maltose. To remember this, we'll have Mac inspecting a bottle of malt liquor that was left at the crime scene. The malt, of course, is for maltose. And you'll notice he's using this long nasopharyngeal swab to soak up the saliva at the top of the bottle. This is to remind you that Neisseria first colonized the nasopharynx, and it's transmitted via respiratory secretions. This could be through sneezing, coughing, kissing, sharing drinks, or even just close contact. So what's Mac doing in this room anyway? Well, he's actually here to investigate the death of a college kid in the dorm. And he's trying to figure out whether it's an accident or a murder. So let's draw this college kid here on the ground. Alright, so the first clues we'll look at are these syringes on the floor. Mac has covered them up as valuable clues in his glass capsules. And of course we're using these glass capsules to help you remember that Neisseria meningitidis has a polysaccharide capsule, which is one of the important virulence factors because this capsule inhibits phagocytosis. You were probably given a vaccine for Neisseria meningitidis before you started college, and these vaccines contain a polysaccharide capsule, which is why we have syringes under these capsules to help you remember this. Notice how there is no vaccine under capsule B? Well, that's because the type B capsule is not included in the vaccine. For this reason, most infections in the US and other developed countries are caused by the type B strain. So we're adding another piece of evidence that may be a lead into this suspicious death. It's a flag with a sickle and hammer on it. Uh-oh. Max should have known the whole time. It seems like this young man here had some secrets. It seems as if he was a communist. Okay, no. That sickle should remind you that patients with sickle cell disease are more susceptible to Neisseria meningitidis because it's encapsulated. Remember the sickle in strep pneumo? Same deal here. To really teach you this, let's go through the pathogenesis one step at a time. Meanwhile, each symbol that we walk through will also help us solve the mystery of this college crime scene. So remember I mentioned that the bacteria colonizes the nasopharynx? Well, after it does, it establishes infection by invading and spreading hematogenously. In the blood, Neisseria meningitidis leads to a massive inflammatory response, which is generated by lipo-oligosaccharides, or LOS proteins. These envelope proteins are Neisseria's version of LPS, and Neisseria produces so much of it that it outgrows the surface area of the bacterium and begins blebbing off. And it's these blebs of LOS envelope that cause a massive inflammatory response. So, to portray this, we're going to have a stack of envelopes that have caught fire. Suspicious. Burning envelopes. And Mac knows only one type of person burns envelopes. A communist. Sorry, I really like doing that. So the first step of pathogenesis is the inflammatory response, and then this leads to increased permeability of capillaries and leakage of fluid into extravascular space. This leads to hypovolemia. So what happens after a fire goes off in an apartment? The sprinklers go off. So this is perfect because these leaky sprinklers are a super easy way to remember these leaky capillaries. Now that the sprinklers are going, the carpet's beginning to get soaked. So we're drawing some wet spots on the carpet. And these are to remind you of the next phase of the illness, a characteristic petechial rash. This is an extremely important physical exam finding because it's an indicator of thrombocytopenia in the patient. Even the smallest petechiae can quickly progress to purpura or ecchymoses, and if that happens, that's a really strong indicator that this illness is progressing to disseminated intravascular coagulation, or DIC, in which you would then see some oozing at the venipuncture sites or bleeding gums, all signs that the patient's very sick. So the mechanism for Neisseria causing thrombocytopenia leading to DIC isn't exactly clear. But in any case, think of meningitis when you hear about meningitis with petechial rash. So aside from the spots on the carpet, we've also made our college students' boxers dotted with red spots. So these will remind you of petechial rash. Now Mac is starting to put the story together. The water from the sprinklers trickled down the wall and over this outlet, causing it to short and then shock this college student, which is what brought him to his untimely end. So this is to help you remember that the capillary leakage can lead to hypovolemia and shock. And on top of all of this, there's another disease process that can happen in these patients that contribute to or worsen the shock. As a patient becomes hypovolemic, peripheral vasoconstriction goes to a maximum in an attempt to maintain blood pressure. When this happens, one organ that can become poorly perfused and infarct are the adrenals, and the resulting adrenal insufficiency further contributes to the shock and is very often fatal. And this destruction of the adrenals is called Waterhouse-Friderichsen syndrome. And to remember this, we're going to draw a water house, or a water tower, outside of the window here. So now you have it, the entire pathogenesis of meningitis infection. Encapsulated Neisseria meningitidis are transmitted via respiratory droplets. Their LOS envelope proteins bleb off and cause a massive inflammatory response, leading to leakage of capillaries and consumption of platelets, which then leads to development of a petechial rash. The capillary leak leads to hypovolemia or shock, which may lead to infarction of adrenals, or Waterhouse-Friderichsen syndrome, which worsens the already bad hypovolemic state and further contributes to shock. And the overall mortality rate in patients with meningococcal meningitis, even with antibiotic treatment, is approximately 15%. And besides hearing those nasty numbers, early treatment is still important and can definitely improve outcomes. The empiric treatment of choice is a third-generation cephalosporin, and you need one that can penetrate the blood-brain barrier, like ceftriaxone. So this is the drug you should remember for the step 1. To help you remember the treatment, we'll have a firefighter here responding to the scene carrying 3 axes. Why 3 axes? I don't know. I also am not quite sure why he's pointing to the victim. Good job, fireman. You found the dead guy. Since this infection is easily spread by airborne droplets, it's important to give close contacts prophylaxis. Close contacts are defined as someone who has spent over 8 hours of close contact with the patient during the 7 days prior to onset. And the drug most commonly used for this is rifampin. So to help you remember this, we'll have the person's friends or close contacts trying to peek in at the scene from behind the door. And we'll have a policeman stopping them with our rifampin rifle strapped to his back. And that's it for Neisseria meningitidis. Now that we're done drawing the crime scene, I'd say it looks to me like this could be an accidental death. But then again, I'm no Mac the private eye.